Hi guys, and welcome back or welcome to my YouTube channel. My name is Bridget and I have been MIA for the past like 6 or 7 months. I was just really sick and really busy working, and then this craziness all happened, so I haven't really come around and been able to have time to make a video, but I'm here, I'm back, and I promise I'm going to be posting so much more. I have a ton of stories for you guys. I have a ton of information to share. So I am back and I am ready. But before I hop into today's video, I do just want to talk a little bit about everything that's going on. I just really hope that everyone is keeping their head up and doing everything they can to, stay positive during this time. I know everything that we're seeing on the news, it's so crazy and horrific, but I really do think that we can find the positives in this and just try to be, as positive as we can through this whole experience. When I drive around and I see homeless people, it just breaks my heart because they don't even have a home to, a place to call a safe place right now. And it's just a blessing that we have a roof over our head, that we have cell phones, that we have entertainment, that we have, a place to go when we're scared and when something like this is happening. And I also really do just encourage everyone to get outside for, 10-15 minutes, walk around your neighborhood, just get a different view besides a screen. And it really helps me just going out for a walk or a drive. I feel free. But all right guys, well, let's go ahead and get this video started. Okay, so I woke up during one of my procedures. Pretty much. So about 1.5 years ago, I was diagnosed with my ulcerative colitis. And obviously, just like any disease or anything, you have to have testing done in order to determine what, disease you have and what exactly is going on. So about 2 years ago is when I first started throwing up blood. And that is when they decided to start testing me to see what exactly is going on. And the 2 tests they needed to do to see what was causing the bleeding is an endoscopy and a colonoscopy. And when I was first admitted, they were going to put me under a twilight sleep for the endoscopy, and they were going to put me under full anesthesia for the colonoscopy. So I was like, okay, that's fine. And when I asked them what they were going to use for the endoscopy, they said they were going to use fentanyl. And if you're not familiar with fentanyl, it's a very strong painkiller, and in very high amounts it can be used as a light sedative because it's so strong. After I had asked them and they had told me that they were going to use the fentanyl, I explained to them that I had been given fentanyl a couple times prior and my body does not react to it. My body, it's not strong enough. I have a very high tolerance for pain and for pain medication, and fentanyl has just not worked at all for me in, prior times. Like for pain, it doesn't even help, so it will not even work as a sedative. So I tried explaining that to them, and the doctor was like, no, we do this all the time, you're very small, we're gonna give you enough to make sure that you're completely out. I was like, all right, well, as long as you promise that I'm gonna be completely out before you do anything, then alrighty then. So then we go ahead and we go into pre-op. I would usually spend about a half hour, 45 minutes in pre-op before you go into the actual operating room. And they usually give you your medications and prep you and everything before you go in. And they usually always give you a medication called Versed. And Versed is also something that just kind of relaxes you, and it also kind of creates a little bit of a memory loss, so you just kind of forget everything that happens and you don't really remember anything that happens in pre-op. So like I said, they usually give that medication about a half hour before you actually get into the operating room. So by the time you get into the operating room, you will not be, kind of really aware of what's going on. Although that didn't really happen. When I first got into the room, I signed my papers and everything, and then I waited about a half hour, and she went ahead and she came over and she gave me the Versed, and then she told me that there was some students that were there and if it would be okay if they would watch during the procedure. And I figured, majority of these students probably see a lot of older patients that get these procedures done on them, so it would probably be a good experience for them to see like a younger patient. So I was like, yeah, you know, of course. And I asked how many students would be in the room, and she said maybe about like 3 to 4, just, you know, a couple. So I was like, yeah, of course, a couple students, and, you know, I think that would be a cool opportunity for them. So I signed the papers. She gave me my versed, and then within about 5 minutes, we start heading to the operation room. And they're wheeling me in, and as soon as those doors open, there is about 12 to 15 students, like a small class of students in this room. And then I just see the doctor in the very corner of the room. So I'm like, okay, definitely not 3 to 4 students. So then again, they wheel me in and they move me onto a different bed. And I'm just in there for a couple minutes, and before you have any surgery or procedure, a doctor will always come up to you and they'll ask you, you know, like your prior medical history and, you know, what procedure are you getting done, just so you know, or just so they know that you're aware exactly what is going to happen. So he comes over and he asks me, oh, what's your prior medical history? Do you know why you're getting this procedure? Blah, 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 blah. Kind of the same old stuff. Except with him, when I was answering my questions, he seemed like he was in shock when I was giving my answers. Like he had genuinely had no idea about my prior medical history at all. Like when I told him about my one autoimmune disease that like was really rare, he was like, oh my gosh, like I've never met anybody with that before. Just seemed very, very off. It was not a good first impression, to say the least. So he's in the back doing prepping or whatever he needs to do, and I'm on the bed waiting, and the students start to come over and they start prepping me while I'm fully awake. And they strap my head down to the bed, and then they go ahead and they put the little strap around my mouth. And because for the endoscopy, they just put a tube down your throat with a camera. So pretty much I have this over my mouth, and there's just like a little hole that's big enough for the camera. So they're strapping me down, and then at this point I just start crying because I'm like fully wide awake. I see exactly what's going on, and, you know, I just, you know, thoughts start racing through my head, and I'm just getting scared at this point. So then I'm crying, and the nurse comes over and she's like, it's okay, it's okay. I'm gonna start giving you the fentanyl now. And I'm like, okay. So I close my eyes, I try to relax, and she starts giving me the fentanyl, and within about 30 seconds or a minute, I fall asleep. And the next thing I remember is just a super bright light and feeling extreme pressure. And I just remember trying to get up and just like moaning and trying to talk, but I can't because something is in my throat. So I'm like yelling and I'm trying to get up, and as soon as I feel like I can talk, I'm like, don't hold me down, don't hold me down. And I'm trying to get up and I can't. And as soon as I get up, I'm just screaming like, don't hold me down, don't hold me down, don't hold me down. And they finally wheel me out of the operating room. And as soon as I get into my hospital bed, I lost it. I completely lost it. I just started screaming at the top of my lungs. I was having a complete panic attack. I was going crazy. I was yelling and I was begging my mom. I was like, I'm having a panic attack. I can't calm down. Can you please ask the nurse to get me something to calm me down? Like, I don't know what's going on. So the nurse came and she got a medication for me, and she's like, okay, but we're gonna have to give it to you as a shot. And at this point I had 2 IVs. So I was like, why do we have to give me a shot if I already have two IVs? And she was like, well, if you're declining this, we're gonna have to hold you down and give it to you. And that's where I'm just again beside myself. And I literally said, is that all you guys are trying to do at this hospital, is hold people down? So she was escorted out of the room and never came back. And I just continued to have a complete mental breakdown. I was screaming at the top of my lungs for like 2 hours. I was ripping my hair out. And I woke up the next day with hair missing and a huge bruise on my forehead because I was banging my head up against the railing of my hospital bed. I literally had a mental breakdown. I don't know if it was because of all the medication, because I woke up during the procedure, if it was a mix of all the medication and waking up during the procedure and just feeling like I was being held down. And I don't know if it was the straps from the bed or the doctor himself that was holding me down, but it just, you know, when you're in a situation like that, I think I just went into straight like horror movie, like, oh my gosh, are they trying to finish this procedure while I'm awake? Like, no way that's happening. So I was terrified, to say the least. And we reported the doctor. It was an experience I'll never forget. I wasn't able to eat for 4 days because they screwed up the endoscopy, so I wasn't able to eat for another couple days and all that fun stuff. But I ended up getting my endoscopy and colonoscopy done at the same time under full anesthesia. So had they would have just listened in the first place, it would have been done a lot easier. But on that note, I really do just want to add that if you know that your body is not going to react well to medication, if you're allergic, if you whatever, you need to let the doctors know, because it took me way too long to realize that I can speak up. I do have a say in what's happening, and doctors are not right all the time. And had they would have just listened to me and been like, maybe she does know her body better than we do, I wouldn't have had to go through such a traumatic, crazy experience. So please just remember to speak up. This is your body and you do have a say in what's going on. I mean, as a patient, I can definitely, you know, it's scary to sometimes speak up and say like, no, these are the medications that work for me, because obviously doctors, you know, they're always just gonna go right off the bat and be like, oh, drug seeker, she wants this medication, you know, blah, blah, blah. But it's always better to speak up and have something done than not speak up and have a reaction and have a horrible experience happen. So please remember, it is your body. You do have a say. And again, guys, I'm going to be sharing a lot more stories with you. This one is just one in there. I look forward to posting more videos for you guys. Please don't forget to like and subscribe. And thank you so much for watching. Have a great day. Bye.